Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, Ph.D. and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we're going to be talking about autism. Recently, the Center for Disease Control came out with shocking statistics in terms of the prevalence of this disorder. 1 in 68 children has some form of autism. It could be severe, it could be moderate, it may be mild. That's a lot of children. But what it really translates into are families like you watching this show. 1 in 34 families are affected with a child with autism. Now just think about this. Most everyone that is watching this show knows 34 families through your friendship network, your church, your synagogue, your community, your school, whatever. Someone that you probably have touched or known has this disorder because it is becoming so much more prevalent. Now, some people think that's case finding, other people dispute that, but that's not the focus of our program today. Today, our program is called Awareness is Not Enough, Learning to Live with Autism. We're going to be talking about awareness, acceptance, and managing, and really starting to enjoy that person who has autism. Really appreciate who they are. And the person that's really going to be our facilitator in helping us to understand this at a deeper level is Dr. Robert Naseef. And let me tell you about our guest, Robert. Robert is a very seasoned professional person, and he runs an independent practice with this kind of problem in the Philadelphia area, which he told me is a hotbed of information around autism in this entire community. So we're really drawing from his expertise and the expertise of many other people that he works with. So in working with families and children with autism, he has really helped people have breakthroughs in how to really deal with this in their own family systems. He has published scholarly works. He's done all kinds of things to really raise awareness, and more importantly, to help people take the appropriate actions so that their lives can be improved. So I really want to welcome Dr. Naseef to be with us today. It's really a pleasure to meet you and to really, again, draw from both your personal knowledge and your professional experience. So thank you for being with us.
Well, thank you. It's a pleasure to be here, Nancy, and have this conversation.
That's wonderful. Now, I think that often when people go into a certain field, the first question is, what was happening in their lives? Why did they go into this field? And Dr. Naseef, by the way, has written a book about his own experience. His book is entitled Autism in the Family, Caring and Coping Together. And this book really is a very good guide for any parent or teacher who is really dealing with this problem, because he has been, again, talking from his own experience. In addition, he got a Ph.D. in psychological studies in education, and his dissertation was entitled, What Helps Families of Exceptional Children to Cope Successfully? So with that wonderful background, start us out with your life experience and how you even became aware of autism yourself.
Well, my son, Tariq, who's on the cover of the book there with me, was born in November 1979.
Okay.
And his first about year and a half were seemingly very normal. I mean, it was really exciting. I can, vividly remember holding him for the first time and making eye contact 1 day old, and just all the little developmental milestones that infants have. And raising his head and looking around, cooing and babbling, playing together, crawling, cruising around, walking. He actually walked on his first birthday right before the party.
Uh-huh.
It was like the Super Bowl to me. It was so exciting, And as a father, he's like the mini me, And I really just exalted in the joy of my first child and my son, my only son, and it was all great. It seemed perfect. And then, and he started to speak. He would string a few words together. And then around 18 months, he stops talking. He starts sort of flapping and spinning, what we now call the red flags of autism. But it was 1980, and there wasn't a lot of awareness of autism. It was, like 5 in 10,000 children diagnosed with autism in the 80s.
That's a big difference from what it is today.
Oh,
shocking.
It's shocking, and it's huge. It's and like you said in your opening, that is another topic, but at that time, almost nobody knew the word. Compared to now, everybody knows the word.
Right.
Like awareness, right? Everybody knows the word. But what it actually means for an individual child and a family, that's complex and nuanced.
Right. But let's go back to your own experience. I mean, with this child, he was just, a little rock star for you. And I can see you certainly enjoyed being a father.
Oh, absolutely.
Yeah.
It was great. I mean, it was great.
So this was your entrance, but with that behavior change, was it dramatic in the family? I mean, what?
It was slow. I mean, and it was like he was slipping away, but I didn't know it.
Mm-hmm.
I didn't know it. But by the time he's 18 months, he's not talking anymore. He's irritable. He's, playing with the same rattle, this transparent rattle, and he's like looking at the beads inside, and he's like, like this, and he doesn't want to engage.
Studying the rattle.
Studying the rattle. He's pushing me away. He's pushing his mom away. He's, it feels like a rejection. The little boy would run to me every day and couldn't wait till I get home. Now sometimes he runs to me. Sometimes then he just wants to go in the corner and play with the rattle. And
so in terms of the marker of time, I mean, by his first birthday, he was doing everything, if anything, not only on time, but maybe even a little bit early. And then it was over maybe the next 6 to 8 months that you started to see this very gradual decline. But you weren't really necessarily focused on it, except you were noticing these sort of individual behaviors.
Right. That's how it sort of comes on. And then talking to the pediatrician, and oh, well, he was talking, he'll talk again. Well, we'll just watch this. And he had an excellent pediatrician, and on his well child visits, the pediatrician was like checking off the Denver scales, and he really was on time, at 12 or 14 months, and by 16 or 18 months now he's behind. He's not pointing. He stops talking. And I just kept thinking at that point, it'll come back. It'll come back.
Well, you were also getting reassurance. I mean, that's the other thing. You were seeking professional help. But I think what we're learning as we really journey through these discussions about autism is that the healthcare provider community didn't know a lot about it either. So, I mean, when you have a young child who looks very bright and capable, you want to be optimistic. I mean, and that's probably part of what was even fueling the pediatrician to give you and your wife reassurance.
I think so. I mean, he was a good doctor. He was faculty at a medical school. He appeared on TV. I mean, I thought, like, I want a good pediatrician for my son, and here he was. But it wasn't obvious to him the way it might be today, when, like today, a lot of pediatric offices are screening children at 1 year, at 18 months, using screening devices that are, that identify children that need intervention.
Right. So
but that wasn't going on then.
Right.
But he was checking off the Denver. He was more advanced than most pediatricians of the 80s, when I think about it.
Right. So this Denver tool is really to track on developmental milestones, and he was doing okay. So, I mean, we're going back, 30 years, 20, 30 years.
Right. So that was actually, as we're sitting here, and it's coming up to May 2014, 33 years ago, my son spoke for the last time.
You can even remember the date.
Not the date that he stopped speaking, but I know that by 18 months, 33 years ago, that perfect baby was gone, but I didn't realize it.
Right.
But it's been that long, and I've been living and learning about autism in my own life and in the lives of other people and the science around this, like it's 33 years of learning now.
Wow, that's really impressive. What happened in your own experience with your child that really sort of took you from not being aware, having concerns, trying to address them, not necessarily getting any clear answer, to really moving to a different level of understanding?
Well, that's a good question. And I remember that vividly as well, although, I haven't talked about it for a while. It was when he becomes 2 and we take him to nursery schools. Just thinking okay, he's in a bad mood, but it's time for nursery school, and nobody wanted to take him. And then we take him to a Montessori school in Mount Airy that said they take children who are delayed and have learning differences. And we sit down with the psychologist who says, I don't know what this is, but something's not going right. And that kind of started everything. And that psychologist, Dr. Saul Fisher, is one of my good friends today. But at the time, he's the psychologist at this school, and he says, we better test his hearing.
Uh-huh.
So that started it. And I think parents still get advice like that, because if a child isn't hearing, that certainly could be causing a lot of these issues. So then there was a hearing evaluation. And he was hard to test, but and he had ear infections, but apparently he could hear.
Right.
And so that kind of started it all. And then, okay, regular nursery schools won't take him. He's got to get into early intervention. But that process took early intervention in the mid-'80s, started at 3. Today it starts at birth. The federal laws have been updated, but it started at 3. So by the time he's 3, he's in an early intervention preschool in Mount Airy.
Right. But when did anybody ever say the word autism to you? It sounds like this psychologist was able to at least say these behaviors are not just simply one and this one and that one. There's a whole behavioral complex here that just doesn't fit. Let's take one thing at a time and evaluate it. But then as time goes on, how did it become a more sophisticated diagnosis, meaning clarity? You finally got some clarity about this.
Well, the first time anybody used this word was Tariq's speech therapist in early intervention, and she gave me a little brochure with stick figures and the symptoms of autism. I'm not sure if she used the word or not, because it was kind of a blur, and I couldn't really read that thing right away. I mean, he did everything that was on there. Flapping, spinning, not talking. He did running around aimlessly, bouncing off of things. He did everything that was on there, and I couldn't get the word out of my mouth.
Right.
I could not say the word or wrap my mind around it.
Can you say why you, from your memory, why that was so tough?
It was terrifying. It was like a nightmare, because there was some sense of permanence. Like, if your child has this, it isn't going away.
Right.
And so then there was other evaluations. Then there was an evaluation at a hospital, a multidisciplinary evaluation. And they used the words pervasive developmental delay, mental retardation, autism. I couldn't believe it. I thought my head was going to explode.
Right. It was so devastating.
He was 4 by then.
4.
Today people call it the autism bomb, but I didn't know that term then, but I thought my head was going to explode.
Right.
I was going to jump across that table and just grab somebody.
Would that happen today? Because I think people watching this show will have similar journeys, or maybe have had similar journeys. And I guess what I'm searching for in asking you that question is it that tough today to really get these diagnoses clear? That was a tough journey, 4 years.
It was really hard, but the average age of diagnosis is still around 4.
Is it?
Now, it happens much younger. Like then, you really couldn't get it until 4. Like the professional community wouldn't give it because they couldn't be sure, I think. Now you can get the diagnosis at 2 years of age or earlier, but the journey for families is really tough, and so it requires getting professionals who know what they're looking at and families who aren't afraid to ask the question. This is a tough question to ask. And even when you ask it, you don't want the answer to be yes. Could it be autism? I mean, we diagnose autism in our practice, but nobody really wants the answer to be yes.
Right.
Except maybe an older child where people know there's something and they don't have a name for it. But generally, people want the answer to be no, nothing that serious. So, I think it's a very similar journey, even though it's 30 years later.
Well, that's what I'm getting at. So the question is, how can we really get over even the stigma of the word? I mean, here is a gentleman who is so open and honest, is writing books about this, works with patients and families. He knows how difficult it was, to really hear that himself. So that's really where he can be so empathetic to other people's experience of this. But I guess we get a lot of other diagnoses that are tough, but this one just seems like it's in the really tough category. And that probably is because it isn't reversible. And why else? What do you think are some of the other factors that make it so tough to hear that word?
Well, as parents, we have a dream of who our child's going to be and who we're going to be as moms and as dads.
Right.
I thought I'd be I thought I'd be a better version of my father who loved me, but wasn't always patient. So I thought, I'll be patient. I'll be a better version of my dad. I'll teach him how to play baseball, and I won't get impatient with him if he drops it. And that he would be a better version of me,
right.
A better athlete,
right.
A good student. Although I was a good student, I thought he'd be a better student. So our dreams and fantasies of, not just for our child, but for ourselves and our family, they're kind of, put on hold, deferred. I mean, in a sense, we have to make new dreams of who we can be now as moms, as dads, brothers, sisters, and who our child can be. And there's such wide variability and wide possibilities,
right.
Even at the moment of diagnosis. I mean, Stephen Shore, for example, was nonverbal at 4. He's a good friend of mine. He's a professor of special ed today. So there's so many, so much variation and so much possibility that it's a matter of learning to live day by day and nourish your child and enjoy the child you have that helps that little boy or little girl grow into all they can be.
Right.
And whoever they can be, that's part of the human family. That's what I've come to understand.
That's beautiful. Now, I think what is really fascinating about this self-disclosure of this journey is that your child obviously had severe symptoms. I mean, this was not something that was easy to miss, just observing your child, even earlier than age 4. But it was hard for people to put that label on it. How about people that are in that moderate or mild category? Because the reason I'm asking this is to get to acceptance, you have to at least know what you're dealing with.
Exactly.
So how do you even identify it?
I think at the milder end of this, it's harder to wrap your mind around. It's harder to accept because it's so easy to just think, if I just do the right thing, everything will be all right. And that's natural. That's entirely natural. That's not a defective parent. That's, and it's one reason I think this is particularly hard for moms who feel more responsibility in terms of the everyday nurturing. That the less severe symptoms, we really think we can make them go away. Now, what's the truth of it is that many of the symptoms become less, and that every child on this spectrum, from the most severe to the least, will grow and develop. Like, that's almost a certainty. But learning to live and nurture that and celebrate the little things that can happen and build and have a good relationship, that's the challenge of living with autism.
Right.
sort of letting go of your own goals and objectives and fantasies and being able to just grow your child to whoever they can be. That's the process, right. But I think it can be more challenging for that child that's almost normal, so to speak.
Right. Well, I think that is very challenging, because who do they even go to talk to? They may not even be bringing it up to their pediatrician. Do people in school systems see this? I mean, who's out there in the contact point of the world that would really help parents that are listening and people that they know to say, maybe these behaviors are worthy of further analysis and diagnosis? And then the next question is why? I mean, what am I going to do with that information? What can we do with people that appear to be functioning but have these behaviors that are questionable?
Well, parents can always ask school districts to do a comprehensive evaluation. To do that, they merely need to write a letter to the principal, and that triggers an evaluation. They can also go to wherever they live, to major medical centers, to see a developmental pediatrician, who can who has another residency on top of general pediatrics and is much more skilled in diagnosing. And so in Philadelphia, we have an excellent team of developmental pediatricians at Children's Hospital and others in the area. And likewise, they could see developmental or child psychologists, many of whom are trained to recognize and diagnose. So there's a variety of folks. And you can just get help for the symptoms, say problems with language. And if you got that help, many speech therapists would be able to tell a family, well, it looks like more than that. Or maybe you should go for a more in-depth evaluation, like I can work on the speech.
Right.
Or an occupational therapist that helps with handwriting and motor skills might recognize more. So I think, but wherever a child is on this, part of the living is dealing with the specific symptoms. That's always a part of it, and there's always a difference you can make by acknowledging the problems and beginning to work on them. And then if it's a broader picture, I think somebody's going to pick it up. And also, as parents, now we have the internet, which didn't exist when my son was young. So there's a lot of information out here. Of course, that can be overwhelming to sort through.
Right. Well, talk about some of the other symptoms. I mean, with the twirling behavior, the flapping of the arm behavior, the inability to pay attention to things. What are the other kinds of symptoms that people would see in the milder or moderate categories?
Well, you'll see that difficulty sustaining attention at times, or you'll see very narrow interests, and that a child might be say, very interested in Thomas the Tank Engine, and to the exclusion of anything else, and to the exclusion of other activities, and gets upset when you pull him away from Thomas the Tank Engine. So that's a little more subtle, because that's a boy who at times seems to be playing appropriately. But there might be a child who's just lining up cars, or lining up Lego blocks, not building anything out of them, but just lining them up. But very intent on that.
So repetitive behaviors, a lot, whatever they may be, repeating either in toys or in some other way.
Right. It could be, yes, the twirling, flicking light switches, flushing the toilet over and over. Yes, repetitive behaviors of various kinds and narrow interests. So with the children that are less severe, a child may be in school and only interested in dinosaurs, or only interested in planets, and stays with that narrow interest, doesn't want to do other things. Has a hard time getting away from the narrow interest, but could be very bright and capable of more.
Well, I think that getting to acceptance is really very, very key to this, because the way to get to acceptance is to know what you're dealing with. And I think that that's been, as we're hearing from Robert, a very tough journey for many, many people. It's not like heart disease, where you can go in and do certain tests, and there's easy things to take, not that they're so easy, but they're not obscure like some of these can be at times. So you do the tests, you can have the person listening to your child's heart. There are all kinds of discrete things that can then be factored in. This looks like you've got to really be a good observer of behavior of your child. You have to be willing to step back as a parent and not be making excuses for your child's behavior, but being willing to look at them as they do relate to other children's behaviors and being able to say, this is different. My child is doing something that's very different.
This is falling outside those norms.
Right.
And
right.
That's tough to admit to yourself.
It is.
Without that kind of honesty, we can't get the help we need.
Right.
That's the problem.
Right, and I think that is really the takeaway from this discussion, is that to be honest with yourself is very, very emotional and very, very hard. But unless you are able to take that next step, as hard as that may be, it really doesn't help your child, because you really can't get certain interventions that are really going to help that person as well as help your family. Now, it doesn't mean you're going to get help that's going to take it away. It's not necessarily going to reverse the problem, but it's going to help people to live more effectively with it. Is that what you're doing with people?
Oh, absolutely. See, once people start getting the appropriate interventions, they become hopeful.
Right.
Whereas they might be devastated, upset, irritable, depressed. Once they get the services that make a difference, there's some sense of hope. There's a sense of, okay, now we know some things to do, now we're making progress.
Now we're talking about the parents.
Yeah, the
Right.
parents. It's a bumpy road. It's a bumpy road, but at least now you know the road you're on and you're able to make progress. You know the right questions to ask. Now you start understanding what this means. And not just, and what it means is static. It's not static. What it means changes almost constantly.
Right.
So it's been Autism Awareness Month, and I've been asking parents and young people with autism and adults, like, what did it mean to you when you first heard this word, and what does it mean to you today? And one mom told me, it means something different every day.
Yes.
When I'm with my child, I see something different every day.
Right. But there I think lies the hope and really the core of this discussion. And that is, if you are able to be taking that next step, you will feel better as well. I mean, it is a whole family experience, that the individual mother, father, other key family members will really know what they're dealing with, which I think is different than simply labeling someone. I'm sure that part of this fear is, if I put this label on my child.
Oh, that's big. That's
Yeah.
one reason people hold back from asking the questions, because they see that like as a life sentence, and there's a reluctance. And I felt the same way, really. I felt
Right.
the same way. But it was also the only way to get the help that would make
Right.
a difference.
Right.
That's unfortunately how our system works.
Right. And I think people are afraid of labels, and they feel that if the labels are fixed, then people will deal with their child differently, not in a good way, not in an accommodating and understanding way, but in a negative and exclusive way, excluding them from other things. But is that your experience?
Well, I think it varies. I think there's some truth in that, because once you get a label like this, there's a sense of, and I think this is the initial experience for most families, just a sense of being alone and different.
Right.
Not just that your child's different, but that as a family you're different. But that doesn't have to be static. There's, as you pointed out at the beginning, there's a lot of families going through this, and there's a community of people that's active and doing things. So you can actually connect in a broad sense. But some people act like it's catching,
Right. Right.
And, some people will not respond positively. But I think by and large, once, as parents, we're accepting, we find support. But when we can't say the word or think about it or reach out for help, well, then there's no support to be had.
Right.
And that's even true within the families that we come from.
Right.
There's that ability to understand it and talk about it that generates as much support as possible.
Right. Well, I want to thank Robert Naseef for being with us today, because the title of our show, Awareness is Not Enough, Learning to Live with Autism. Really, this show is step one, getting to acceptance. We want to get from acceptance to really more intervention and a deeper understanding, but you can see what a tough first step that can be for everyone. No one is left out. Here's a very intelligent person who had a great education, was very open to new ideas, and would be able to see their child in a different way. Took years, really, of different milestones of acceptance. And I think that I want to thank you for being so open and honest and really telling people what your story is, because through your story, a lot of people will be able to identify with this. And I think that our whole journey here is to help people take the right actions and to do the right thing. So I think today we've learned a lot. I want to thank you for being with us today, and I hope that you learned something that you can take away with you and share with others. I would like to invite you to come back and learn more. Dr. Naseef will be with us again. In the meantime, remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.